All right. Great. Hi, I'd like to share our experience with non-surgical revision rhinoplasty or non-surgical rhinoplasty. For over 35 years, we've been able to help people, particularly those who've had some imperfections after their original cosmetic nasal surgery. It's possible to improve the appearance of the nose using injections which are permanent instead of surgery. It's more efficient, it costs less money, there's no downtime, and we have control over the results. What we can do is show you, before committing to the series of permanent injections, what the final result will look like. It's called a demo. We demonstrate the result using sterile salt water. We inject it, and within a minute, you can see the result holding the mirror in front of you. That tells you what you can expect to receive. It's terrific. It's possible to improve the appearance of the nose using injections which are permanent instead of surgery. When we're done with the filling, that will predict the end result. However, when we do the permanent filler injections, it's done step by step. And that one series of injections, it may be 2, 3, sometimes 4, will give the patient the result that he or she wants. One patient called our technique of using a permanent filler material his rescue rhinoplasty. We're rescuing the nose from an imperfect result.
I mean, it was a family nose. Well, I had my first rhinoplasty done in Orange County, I believe like 2007. So I had, asked around, done some research on a doctor down there, went and saw a doctor. I didn't get the best vibes from him, and to be honest, I mean, if I can give anyone a piece of advice before getting rhinoplasty or any sort of plastic surgery done, it's to really get to know the doctor, ask as many questions as you possibly can, and make sure that you feel comfortable with them.
So she came in and said to me, I've been to other surgeons, they're all saying the same thing, I need to have another operation. One could see that the grooves and troughs and irregularities were significant. It would take a surgical procedure involving grafting, meaning taking cartilage from elsewhere and transplanting it under the skin to attempt to improve it.
It wasn't crooked, but because of the way that one side was more of a ridge and the other side was a dent, it came off as crooked. For a long time, I just kind of lived with it and figured that this was as good as it gets. And then I found Dr. Kotler. So I highly recommend coming in about 30 minutes before you get the procedure done, even for the saline solution.
Well, the fabulous Dana is back today, and she's had several treatments because it's done incrementally. We've layered in the filler in the past several visits, and today we're going to do a little topping off. Just the tiniest little bit, just a few micro droplets to make the bridge of her nose symmetrical and even. I'm wearing a very unfashionable but very important magnifying lenses because we want to see every detail. Dana's skin has already been anesthetized by an ointment that was placed 25 minutes before. Very important for maximum patient comfort to have the skin as anesthetized as much as possible. 6 seconds injection.
And I never feel anything.
Yeah. Okay. Now, first I'm just going to prepare the skin with alcohol. Very good. And now I'm telling Dana I'm just going to have a little contact with her right cheek and left so that I can place the injection very carefully and deliberately in a small area on the side of her nose. Okay? You feel just a little pressure, a little vibration going in. Good. And all we're doing is plumping up the area right next to where she's got a little bit of an edge. You want to hold that for me, Dana, just for a second? Good. Okay, give me 1 second. Now at this point I'm going to ask Dana to take a look. She knows her nose. She knows what she wants, and her opinion, of course, counts more than anything. So by looking and feeling, she'll have a sense of how close we are to the end point. I can always put a little more, but we're always cautious because, frankly, we can't take out what we put in.
But yeah.
Tiniest bit.
I don't know. You tell.
Yeah.
I don't know. know. That side might be good.
See, I think that side is good.
Okay.
I really do. I think our burden has always been to get
This
the left
side,
to
this,
match.
yeah, ridge.
Yeah,
Okay.
Yeah, yeah. Okay, you're right. Just at the very top, just above where I've been.
I think that's
Yeah.
it.
Okay,
And then I think we
good.
got it.
All right.
So I just think we need just maybe a little bit right here. I feel a little bit of that ridge.
Mm-hmm.
But up here, I think we got that.
Right.
Yeah, this
Okay.
feels really smooth, and then that one little spot, and
Got
I
it.
think this side is amazing. This side we
Yeah.
got
Yeah.
really well.
It's very important that both sides be even. Our eyes and our fingertips tell us what we need to do. And again, we're going for perfection here. So I'm going to drop in just the tiniest little bit of additional filler just in one little place. Perfect. All right. So again, you'll feel just a little pressure, just a little vibration going in. Yeah. Again, just the tiniest little bit.
It's a lot smoother. You can't feel the ridge as much as before. It's amazing. Yay!
You can just barely feel, if you push hard, you can feel the
It is smooth,
edge,
I
but
guess I
I'll
can
tell you,
see
it
it
looks,
too.
sure looks smooth.
Oh yeah,
Okay, but here, I want you
definitely.
to, yeah, see what
Isn't that amazing?
You know, it's very important that the patient and I agree. And that's the great advantage of doing this technique because the patient's awake. She's not under anesthesia. She can look, she can feel, because my aim is to make her happy. And it's a collaboration. It's the doctor and the patient figuring out what looks good and how do we get there. And it's a great process because when the patient walks out, they're comfortable because they know what they have. They can see the results.
I'm so ecstatic with the results, and although right now it's a little bit discolored because of the anesthesia, that goes away in probably about 30 minutes. I can go right back to work, and I mean, like Dr. Kotler said, you instantly can see the results. Absolutely.
Cool. August came to see us because he was dissatisfied with two features of his nose. The first was that the bridge was too low. It made his nose look too small, particularly since he had a rather prominent forehead bone.
I feel like it's kind of small and understated for my face, and I wanted to get Dr. Kotler here does some wonderful treatments that he does saline injections first, and that way you can see what a more permanent filler would look like.
Secondly, his nose was asymmetrical. It looked a little crooked. And it looked that way because the right side in the upper portion was a bit caved in. I felt that he didn't need to have rhinoplasty or cosmetic nasal surgery. That using permanent fillers, he could achieve the result that he wanted.
So this is kind of like a great test run, and that way I get the visual and he gets to see also how it might look.
It's very important for the doctor to understand what the patient wants. And the best way is to have the patient hold a mirror with the little Q-tip as a pointer and show me what is the point of dissatisfaction. Where should we direct the filling material? So August, if you will, show me what you don't like.
So what I don't like is I have a large brow bone here, a Cro-Magnon brow bone, and then I have a small nose. So there's a ridge that goes from my brow bone down into my nose, and then my nose comes down. So I'd like to have that filled in a bit more so I don't have a shadow cast across.
Well, because August is a nurse, he has a good sense of anatomy. He's correct. His observation is correct, that he has a rather prominent forehead bone, and then the nose starts a little low. So to sort of fool the eye, if the bridge of the nose were raised, it actually will change the relationship. The nose won't look so small, and the forehead bulges, if you will, won't look so prominent. Okay, so I'm going to get into position now, and first I'm just going to prep August's skin with a little alcohol. First, to fill in that dip or groove, or what we call the root of the nose. Okay. Feel just a little pressure, a little drop. Hold on. Medication. Good. Yeah, good. Just to plump it up. That's the idea. Good. Great. Now we're going to put a little more just below there. Same maneuver. He's a great patient. He's not moving.
I don't feel a thing.
That's the idea. Not to fill a thing is good because that's what good anesthesia is. Very good. So that looks good. Now I'm going to put some of the filling injection on the side, and then I'm going to have you take a look at the mirror and see what you think.
Wow,
Okay.
simple.
Yeah, it's good. Great. Tiny bit more. Good. Now we can massage this just a bit to move the filler where we want it. But of course, because it's temporary, it's ideal. So now what I'll do is I'll get you another mirror, right? Because you see the side view.
Wow.
Yeah, it's a while.
That's
It's a
cool.
big, it is a big change. It's amazing. Huge. Yeah.
That's really nice. When can I get the real thing?
Now, the great value in this Saline demo, if you will, is you really get the three-dimensional view of what you can have.
Oh, yeah.
It tells me what the volume's going to be. It allows me to predict the number of sessions. And while we're able to finish the job, so to speak, today, when it comes to the permanent filler, it's layering, waiting 6 weeks, another layer, wait 6 weeks, because that's how the body best accepts it.
Loved it. I can't wait to book it. I've had some time has gone by and the Saline was beautiful. It did exactly what I wanted it to do. And now I'm just ready to actually have the procedure done.
Michaela came to see us as a result of an unusual situation. After pregnancy or weight loss, changed her nose. Michaela was unhappy with her nose because it had almost an overdone rhinoplasty appearance. Yet she had never had cosmetic nasal surgery. There were some dips and grooves, and it just didn't look right. It didn't look natural. So first, we showed her what the end result would be by injecting the sterile saline, the demo. She liked what she saw. And I explained to her the process of using the permanent filler, the only difference in techniques being that with the permanent filling technique, we can't put it all in at one time. We have to creep up on nature a bit.
And in total, it was about 3 visits after the first initial visit, and every time there was more improvement.
As a result of her satisfaction, she asked if I would see her husband, who was born with a sort of a cleft, a vertical groove between the two cartilages that make up the tip. Eric was very impressed with what we were able to achieve for his wife, Michaela.
And so you have a dent, did you say? in
Yeah,
your nose?
yeah, yeah.
Right,
It's
right
like
in the center.
Yeah, it's like
Okay.
these two pieces of cartilage don't connect.
Okay.
You know, yeah.
Is it-
Depending
sure.
on how the light hits you, you can totally see it, and then you can't see it at all. But it all depends. And I've seen photos of myself. I'm like, oh God, what the heck?
Good. Good. Okay. Great. Now a little bit of both, just to fill that cleft. Good. Very good. Very good. So you can take a
Is that it? Wow, that was quick.
Or
See,
you'll peek and see if you want to change some of the, anatomy of the tip.
Wow, that
And
is
bring it
so.
up, yeah,
Wow.
see, so from there to there,
To
no
there,
longer
yeah,
has the
there's
cleft.
no cleft at all.
Yeah.
And just out of curiosity, what's this right here? Does that have the same?
Well, what it is it's a little bit of the cleft and a little bit of flatness. By the way, again, that's what I was referring to. I can pump that up a little more, and we can do it now. That's the beauty of this.
See, nature sort of made a mistake. What it did was the two tip cartilages were separated, so there's that little crease, and then the top was too flat, which is natural. Generally, the tip of the nose is slightly rounded. So
Right, yeah.
we've replaced what nature forgot to do.
Concentrate in this area to build that up more. So we did already, but we can still do more. So that's
You're right. What do you think, honey? What? Do you think I should put more? Not now, but I'm just saying when we actually do it. Yeah.
This is a perfect time to try it while you're here. We'll do it. Right? Sure. See?
Try it?
Test it, sure. That's the beauty. Anything and everything goes.
Really?
Look at it.
Isn't that incredible though? He's already done that, so there's no cleft now.
Yeah.
But in doing that, I noticed there's a little up there that went.
No, we'll be ready. Yeah, good.
That's still numb.
Yeah.
I'm just not sure if my nose is numb enough because when you just did it, I felt a little pinch. Yeah.
Won't take much.
I'll do it again.
You can do it.
Yeah, I might as well just to see. Yeah.
That's the idea.
Okay,
Just
cool.
see. It fulfills curiosity.
Do you want to do some more?
Yeah.
Okay.
Good. I'm going to just do the same thing. You'll feel a little pressure on your forehead, maybe a little drip of the saline solution, and here we go, right into the tip. Good. Just a little bit. Very good. Very nice. So you pull off.
Oh, that's okay. I'm waiting.
Good. And one more little bit.
It must, yeah.
Good.
Yeah, okay.
All right. Now, check that out.
Wow. That is pretty cool.
Yeah. Sterile.
And I don't
salt
even.
water.
And I mean, what do you think? That's incredible.
Yeah.
Looks great.
It's very nice. The advantage here is it proves to us it's doable. The tissues will accommodate it.
That's
See?
It's
shocking.
amazing.
Oh my
Tissues
goodness.
can expand.
I told you.
Totally different.
It
look.
totally does.
Without surgery, and then you will have it permanent.
What's your reason for having the non-surgical rhinoplasty?
I was looking for some sort of alternative to having to have surgery due to after I lost a dramatic amount of weight after my daughter, I just started seeing things change in my appearance facially, and not just looking in the mirror on a daily basis, but in photographs I would notice that it just looked like I had this marble kind of on the end of my nose, which was really bizarre. I hadn't seen it before.
So, we're into the home stretch now, and we're doing fine tuning now. Today we're just going to put a little more filler on the right side of the nose so that that little groove that's present is essentially filled and becomes less obvious. So now we're going to put in just a couple of micro droplets just underneath the skin using, again, a very, very fine short needle. I'm going to just lean on your forehead a little bit to get a little leverage to use to insert the filler. A little pressure. Good. Just the tiniest little bit. Good. All right. And one little spot. Great. Doing okay?
Great.
All right. You're good. And now just a tiny bit more in the adjacent area, and we're done. Good. Good. Very good. And we look for symmetry, where the right and left sides match each other and look natural. And the whole aim of these series of injections was to restore the nose to a natural and appropriate look. So now we have a very happy, very pretty young patient who's pleased with her non-surgical injection revision rhinoplasty, right? Mm-hmm.
So describe the experience that you just had with the saline
It
injection.
was actually really a good experience. There's no pain at all. It took about, I don't know, 30 seconds to inject, and as you can see the results, just borrow the look for a second and see if you like it, and if you like it, then you can do it. You can do it permanently.
Yeah, super excited.
Great, it's great.
Yay!
It feels like it's such a quick, it is a quick procedure, and it's very fast and effective. And Dr. Kotler is very conservative in his approach because he wants to make sure it's perfect.
One thing I love about the staff and Dr. Kotler and about being here is you just come in and you just feel comfortable. I see Dr. Kotler in the hallway, and he gives me a hug, and I enjoy coming here. I enjoy the staff, and I just know I'm in good hands. Nobody else will ever touch my face again except for Dr. Kotler. I drove from San Diego today to get here, and I will drive from wherever I'm at to visit Dr. Kotler.
I'd like to thank our patients, Dana and August and Michaela and Eric, for sharing their experience with you. I think you've had a wonderful opportunity to learn about non-surgical rhinoplasty, that using filler injections can be a wise and practical alternative to surgery. Some patients come to see us because they've had 1 or 2, even 3 or 4 previous rhinoplasties without success. And to be able to offer them this non-surgical yet permanent solution is very gratifying. For all the years that we've performed this, we have continued to amaze patients. They can have the result without another trip to the operating room.